Hello everyone and welcome to Module 9. So this week our main focus is on medical emergencies and how you as a medical assistant will assist in those situations. So for this week we only really have one chapter we're focusing on, and that is going to be chapter 43, goodness gracious. So let's go ahead and dive right into it. So chapter 43 is talking about medical emergencies and your responsibility in those situations. As a medical assistant, you will need training in these areas to make sure that you are prepared. And anytime that there is any sort of an emergency, you always need to let your physician know right away. You may even need to go in depth with dealing with other individuals, depending on the severity. People such as medical emergency responders, emergency medical technicians, advanced medical technicians, and even paramedics. So, when we start this conversation about medical emergencies, there's one law that really is important for all individuals to know, especially working in the healthcare field, and that is the Good Samaritan law. And I'm sure this isn't the first time you've ever heard this term, especially if you've had your lab classes before. I'm sure you talked about it several weeks ago, but it's good to go a little bit more in depth with this. So the Good Samaritan laws were established to encourage healthcare professionals to volunteer in emergencies without the fear or financial liability. This generally applies to situations both inside and outside of your medical office. So let's say that you decide that you're going to administer CPR and you break a rib. They cannot sue you once they've come to and they've gotten treatment because you broke their rib. You did life-saving performances to keep them alive. Now, medical assistants do have 3 legal responsibilities in any emergency. The first is to act within your scope of practice. Remember, you are accountable for yourself, your employer, and the public as a whole. Second, you need to ensure and document the consistent emergency readiness of your office in which you work. So making sure that you're prepared for any emergency that could come your way and doing regular routine training. And last is to do all that you can to prevent these emergencies. Things such as creating a preparedness plan in case that there was an emergency. But as always, we know that emergencies do not come on a schedule. They're more often than not going to be unplanned. Now, there are some guidelines for providing emergency care that you as a medical assistant need to stay on top of and up to date with, especially making sure that you're up to date with your emergency plans for your office, your facility, and the community. But it's important to know that medical emergencies come in 3 main types of situations. They can either come over the phone, near your office, or in the office setting itself. The most common of the 3 is going to be over the phone, and this is where your triage skills are really going to help. Triage means that you can assess and prioritize the emergencies based on the patient's needs. Now, for every doctor's office, you will have an emergency crash kit available for all situations. This is typically a large roll-around cart that will contain all the supplies that may be needed during an emergency, and it should be instantly accessible to all individuals in the office. With a crash cart, or close to the crash cart will be what we have as a medical emergency drug box. And some of the drugs that you'll find on there are activated charcoal, Benadryl, epinephrine, insulin, lidocaine, nitroglycerin, and normal saline. But as always, you want to check this regularly and restock it after every use, so that way you have all of the supplies that you need at all times. So now let's actually get into some of the fun discussions and talk about some of the medical emergencies you might encounter. Now, in your lab classes this week, you should have individuals coming to teach you CPR and first aid. So some of the other things that I want to discuss are things like respiratory distress, which this could be a reaction to a long-term disease such as asthma or COPD. COPD is chronic obstructive pulmonary disorder, but it could also happen due to an emergency situation such as anaphylactic shock to a medication. Typically, this happens as a reaction to medication, and what can happen is your throat will close up and you'll have a hard time breathing. As a medical assistant, you need to be able to recognize the signs and symptoms, which are acute anxiety with gasping breaths, bradypnea, which means slow breathing less than 8 beats per minute, cyanosis or turning blue, nasal flaring, noisy breathing, or they could actually have rapid or tachypnea, which is rapid breathing. Now, if this happens, you may need to administer oxygen to your patient. Next you want to look for is chest pain, and heart attacks are really the leading cause of death for both men and women. And as a medical assistant, you need to know the signs and symptoms. Most frequently, it will be pain in the middle or left side of the chest, described as stabbing, sharping, crushing, squeezing, or aching pain. Pain can radiate to the left arm, up the back, or into the neck. If this happens in your office, call 911 immediately. But if you get this as a phone call, stay on the line with the patient, ask a coworker to call 911, and then stay on the line until EMS arrives. You could also deal with shock. And shock is the collapse of the cardiovascular system, and it's caused by an insufficient cardiac output. Signs and symptoms are weakness, rapid heartbeat, thirst, cool or clammy skin, unresponsive, and nausea. Going in further, we're going to talk about some of the first aid emergencies you may encounter. Now, first aid is the assistance given to any person suffering a sudden illness or injury with the care provided to preserve life, prevent the condition from worsening, and promote recovery. Some situations you may offer first aid to patients who are bleeding, have open wounds, soft tissue injuries, or burns. So let's go into those further. Now, bleeding can be both internal and external. External bleeding occurs when the skin is broken, and this type of bleeding can be controlled. You want to apply a pressure bandage around the injured part to maintain pressure on the site. Now, if the bleeding seeps through the bandage, do not remove the bandage, but instead apply another bandage on top. Internal bleeding occurs with the tissue damage and intact skin. This type is unlikely to be diagnosed in a medical setting and is a little bit harder to control. Open wounds are seldom self-inflicting, seldom life-threatening, unless you have one that penetrates the head, chest, throat, or abdomen. If those occur, contact EMS right away. And as a medical assistant, one thing that you can do is always try to control the bleeding. Most of the time, the injury is not life-threatening and will require irrigation, debridement, sutures, and antibiotics. Now, there are some pointers that you can take while dealing with open wounds. Always apply a dressing that is sterile, covering placed directly over the wound to absorb the blood and other bodily fluids. Apply the pressure bandage with a strip of binding material to hold it in place. Typically, this can be roll gauze or elastic gauze or Coban. So here are some types of wounds that we have. We have abrasions, which occur when the outer layer of skin is scraped away, exposing underlying tissue. Common types of abrasions are friction burns, rug burns, road rash, and scrapes. You can have incisions or lacerations. A laceration is an open wound in which the skin and underlying tissues are torn. It usually has jagged edges and interferes with the healing process. Where an incision is a type of laceration that is cut with a smooth edge made either with a knife or other sharp object. And typically these are all treated in the same manner. Now, an avulsion is the tearing away of the skin or tissue. Avulsions usually occur on the limbs, appendages, including fingers, toes, hands, arms, feet, legs, nose, and penis. You can also deal with soft tissue injuries, and this is trauma that involves both the skin and underlying tissues. For soft tissue injuries, you want to elevate the body part above the heart and apply a cold compress. For more severe injuries, you want to immobilize that body part. And last thing we're going to talk about is burns. And these are a type of injury that occurs when the tissue is destroyed by the action of physical heat, chemical activity, or high electrical current. This can also happen with heavy exposure to radiation. The severity of the burn depends on the amount and the depth of tissue injured. When treating burns, cool water can be used to soothe the area if no skin is broken and there are no blisters. Burns should be dressed with a sterile dressing, and pain should be managed with injectable medications only if ordered by a prescriber. Now, before we wrap up this chapter, I want to talk about emergency preparedness. And this is really the knowledge to know how to respond to an event of human-caused disaster, such as terrorism, acts of natural disaster, or a hurricane. In any situation, remaining calm is actually paramount to the success of handling it. And when we talk about natural disasters, we deal with an organization called the Federal Emergency Management Agency, or FEMA. And FEMA actually declares that floods are the most common natural disaster that we'll deal with, but they also talk about tornadoes, hurricanes, floods, and fires. Alright guys, that is the end of the Module 9 video for you guys. What I do want to talk about for a few minutes is just your homework that you have for the week. You do not have a discussion board, but instead you do have a written assignment case study. And when you go into your assignments, there will be a blue hyperlink to a worksheet that will pop up, and that is actually your case study. What you'll want to do is read through the top part of the case study and answer the following questions that you see there. Now, you will need to do some extra research outside of just the case study, so make sure that when you're doing this, that you are using correct in-text citations and reference pages. This written assignment will be due no later than Sunday, June 4th by midnight. You do have a weekly quiz again on Module 9 and medical emergencies. It is a 20-question quiz that is multiple choice or true-false, and you have a 30-minute time limit. This will also be due June 4th by midnight. Alright guys, if you have any other questions, comments, concerns, please make sure that you are emailing me or giving me a call at my direct line on campus. Otherwise, I hope you all have a great week 9 and enjoy your first aid and CPR training. Bye guys.